Hello, everyone. Thank you for joining Family Connections Adapt Coalition in another one of our YouTube Watch Party series. We are very honored to have our friends from CarePlus, New Jersey, Ratna Joshi-Nelson and Vanessa Castaneda, here to present on CarePlus and some of the services to assist families with uh, treatment and support. And it's something very important during these challenging times that we're in during the COVID-19 pandemic. So, welcome, Ratna. Welcome, Vanessa. Thank you for being here.
Thank you for having us.
Thank you.
And before we get to the presentation related to the amazing services that CarePlus can offer for our families, very briefly, something that we always do during the beginning of our watch party series, we want to familiarize you all with the Adapt Coalition here. We're a coalition dedicated to preventing and reducing underage drinking and substance use disorder in Essex County. We work to empower youth leaders and community members, and we work on collaborations like the collaboration we have with CarePlus to make sure that we can first and foremost improve education and awareness like we're doing now, but also advocating for local and county-wide programmatic and policy changes that can support our local residents. We're looking to do that to make sure that we can prevent and reduce underage drinking, substance use disorder, prescription medication misuse and abuse by all populations, and also tobacco use and vaping use by minors. Those are some of the things that we're looking at here in the county itself. We are structured by a small staff, but along with that, we are a dedicated group of volunteers from adults to youth as well, all over Essex County. We work in committees, and in these committees, we plan and we organize our activities and initiatives that we have here in the county itself. Some of those are examples of doing what's called a brown bag event, where we work with local senior citizen centers to collect older unused medications, or we do outreach as it pertains to our local liquor stores, bars, and restaurants to make sure that we are preventing underage drinking or preventing youth access to alcohol, which is something that's a challenge sometimes in our areas. We are lucky to be managed by Family Connections, which has been around since 1879. And we're funded through various grants from the New Jersey Division of Mental Health and Addiction Services and the White House's Office of National Drug Control Policy. Uh, I've already mentioned most of the stuff that we work on, but just real quick, if you are very interested, we have committee meetings that meet every other month, or committees, I apologize. We have committees that meet every other month, one particularly related to underage drinking, one related to prescription drugs, another one very focused on a specific community. So we work with the interfaith community in expanding prevention resources and programs for our interfaith families. And our LGBTQ plus community is our newest committee, where we work to expand substance use prevention resources and programming for LGBTQ plus residents here in the county. Finally, we follow a strategic prevention framework model, which is a evidence-based program model that looks at beginning with assessing, trying to find out what the issues are. Then from there, building capacity, planning, implementing, of course, evaluating the work that we're doing, making sure that we're culturally competent and sustainable throughout the entire process. So that's a little background about who we are as far as Family Connections Adapt Coalition. But the watch party is really to promote our partners here at CarePlus New Jersey and the family service program that they have. So with that, I will pass it on to Ratna and Vanessa to give us our presentation.
Thank you, Joel. So, Care Family Support Center program is a subsidiary of CarePlus. We are funded by the Department of Mental Health and Addiction Services to provide families that have loved ones that are suffering from addiction. So the way that we first, before I go any further, so the services that we provide are completely free to those that are living in Bergen, Essex, Hudson, Morris, and Passaic County. We are grant-based. That means everything that we do for our client is free of charge to our clients. We will not ask for insurance information. We will not ask for any kind of payment method. Basically, the model focuses on families that have loved ones that are suffering from addiction. We believe that the family plays a greater role in the recovery of their loved ones. One of the ways that we do it is to providing several tools. We have the craft method, which is the actual methodology that we use to educate our families. If it be teaching them how to communicate in a positive level, if it be to help them to secure boundaries, natural consequences, positive consequences. Those are just the modalities of the educational part of family support. We also provide tools, and the tools, what we mean by this is that we may provide them on how their behavior impacts the person who is suffering from addiction. We provide training so that they can continuously practice what they're learning and implement it into their lives so that uh, they build what we consider a ongoing communication elaboration with the person who is suffering from addiction. We also provide face-to-face personalized support in the community. Now, because of COVID, we are virtual at this time. However, hopefully very soon, we will be going out into the communities to meet our clients. They will not have to come to us. We will meet them in public so they do not feel uncomfortable in their own homes, because oftentimes they do become uncomfortable. We also navigate treatment services, not only for the person who is suffering from addiction, but also their family members. So basically, we do not work directly with the individual who's suffering from addiction. We work with the family members. We involve family members in every aspect to get their loved ones into treatment. So, for example, if the individual who's suffering from addiction is ready to get services, we would provide the family with all the resources they need to get their loved one into treatment. If the family member is suffering from depression, or with this COVID, we have a lot of family members that are going through depression, we will navigate them into finding treatment for themselves. If it be family treatment, if it be individual treatment, and for the loved ones, it could be, inpatient, outpatient, halfway houses, housing. These are things that we provide to the family members to give that information to the individual who's suffering from addiction. Um, so why our approach is a little bit individual than most is because we believe that the craft method actually helps the family members, because we believe that actions takes the whole entire community hostage. And what I mean by this is that addiction doesn't just affect the person who is using, but it affects the family members and it affects the communities, because we are the ones who are watching our loved ones walk the streets in complete chaotic mode. It crumbles the family unit, and addiction destroys every environment it sets its foot on. To me, in my own opinion, addiction is like a cancer. There's not a one cure all, method. It could be that every family has a different cultural values. So we have to adapt and maneuver to those cultural values so that we can help and assist the person who is suffering from addiction. So what is CRAFT anyways? CRAFT is called Community Reinforcement Approach and Family Training Program, which was originally created by Robert Myers. And what he did is he looked at the models of addiction services. We have the Al-Anon and we have the intervention model. And both of these models have their ups and downs. So he invented a model that would bring family together as a unit so that no one in the family is left behind. And how CRAFT works is that it uses the basic principles of reinforcement and enforcement. This is to basically enrich and reinforce when the loved one is not using. That means, I'm so glad that you haven't used today. I'm so glad that you are in treatment. And eliminates positive reinforcement when loved one is using. So we're not going to encourage that good behavior, but that doesn't mean that we have discouraged, bad behavior either. It doesn't mean that we be quiet. We just have a different way of talking to them so they understand how their addiction is affecting us. We also assist the families in helping decreasing the other person's use. So we improve in communication, which always helps to structure the family. We forget how to communicate sometimes. Addiction is such a stigma that because it breaks down families, it breaks down the communication of understanding, of strength, of love, and willing to listen to them rather than at them, talking to them rather than at them as well. So it assists family to bring strength regardless of the outcome, whether they go into treatment or where they not go into treatment. The families will receive that strength that they need to make sure that everything is copacetic within the home, including setting those difficult boundaries. We also encourage loved ones to participate in treatment too. So, you could tell someone that, oh, I need you to go into treatment, otherwise I'm going to kick you out. They possibly are not going to listen to that, and they may go, but they're going for you and not for themselves. Oftentimes, people who go into any kind of treatment for someone else usually do not last as long as they go for themselves. So what craft does differently also is it helps the family to communicate with their loved ones to help themselves. Um, we would teach methods as, let's look at the past. Do you remember how life used to be? Let's go and do something fun for a change. Bringing that family unit together. It's the most important part of recovery today. One of the things that craft does, especially in the family support center, is that it creates an opening between isolation and intervention. So we're not doing intervention and we're not isolating them either. It also creates a trust between trust and a bond, because oftentimes when a person who's suffering from addiction has already broken the trust of the family. So how do you gain trust back? Trust cannot be just gained back overnight. Trust has to be gained back little at a time. And because the trust has been broken, the bond has been broken. That too takes time to heal. So what we do, for the community as far as FSC is concerned, we also, encourage this method across the board. So when we communicate with our partners, when we communicate with great institutions like Joel's Adapt. So what we do is we bring sharing resources to the community by practicing the craft models ourselves. We create a better understanding for self-care, because families need self-care. They become very tired and fatigued because they're constantly looking at what their loved ones are doing. What are they going to do next? What are they going to steal next? What are they going to use next? How is it going to feel for me next? They are so involved in what the other person is doing that they become tired and fatigued themselves. So why is FSC and craft, the modality, so important to the community today? Well, we have two aspects of environment. One is family, one is community. So if we're looking at the larger scope, which is the community, we know that addictions, creates high crime. Is what I call a domino effect. So if something gets stolen, the chances are they're gonna steal some more. The cost of detox is incredibly high, and eventually, it becomes what I consider a temporary fix. Unless that person is ready to go into addiction, they're gonna come out, they're gonna stay for 5 days, they're gonna come out, they're gonna use again, they're gonna go back in, and the scenario continues. And this is where FSC comes in, because We are an ongoing service that are helping the family members to stay engaged the whole entire time. Um, in Family Support Center, a family can stay with us up to 1 year. They get continual services up to 1 year. And we do case management. Um, so it no longer becomes a temporary fix. It becomes a permanent structure in the family unit. So they tend to keep the family together. We all also know that high crimes do create violence. And often when there's substance use within the family, there is violence involved. We also, don't encourage disorder within the home. And what ends up happening is that when families are going through this pain, and I consider family pain is very, very as close as the person is using, families get depressed and they feel guilty because they feel they are the cause of the substance use for their loved ones. They become embarrassed because there's police all the time at their home. They get scared because they don't know what addiction is, and they're afraid that if they press the wrong button, they're going to get hurt. There's a constant disconnect between the family members and the loved ones, and there's a constant disengagement of certain family members. Also, we all know addiction costs money. So people are going to, I'm not saying all, but I am saying that somehow or another that addiction has to be supported. And how to support is basically is theft, or if they do go to work, they're getting high at work. So it causes anxieties for families. It causes anxieties for all those that are involved in the impact of substance use. So basically, what I wanted to say is that um, one of the main structures of family support is that we don't force our families to stay if they feel that they have gotten the services they need. We don't force anyone to stay. We do provide the one-on-one would be like, for example, in my case, I call the client twice a week for half-hour sessions. One day would be just, hi, how are you? Is there anything I can do for you? We also have peer support groups during the middle of the week, so people can come and share their stories. We educate them in the craft model in the peer support as well. So there's a continual education proactive mode that's going on with the family members. And then we talk again and we do more educational work. Oftentimes families get stuck in a certain pattern of, the way that they're doing it, that it no longer works for them anymore. One of the things that with family support is that Rutgers does they are the overseer of the the surveys that we do. The families who are suffering from opioid, families that have loved ones suffering from opioid abuse, they take 3 surveys every 90 days. Basically, it's an oversight and data collection by Rutgers, and they want to look at more demographic kind of a look. Does your loved one need education? Is it hard for them to find treatment? How, it's an overall data collection, which we as family support coordinators have to make sure that they're in when they first come in. So any questions, Joel?
Yes, I know that we've had a lot of questions as it pertains to the current pandemic that we're dealing with.
Mm-hmm.
And how has that shifted services or support for families and for the individuals who are in need?
Okay, so a couple of the things that are going on right now is that actually COVID, I don't know if you saw the latest statistics. I think I sent it to you. Just in this year alone, there were 8,000 overdoses in New Jersey, just in the, in during COVID. And it has, with with the stimulus checks that are going out to people, people are spending some addicted people are spending it on drugs instead of their needs. And we have had influx of people who are the family members are going through depression because they can't get out. The individuals are doing drugs because they want to suppress because they're feeling bad. And we are also doing everything virtually. So that human contact that we used to have is not there anymore, or at least not right now. And it hurts the family because they need that human interaction. Just like the individual who's suffering from substance use, loneliness and isolation is not a good partner for many of our families who have loved ones suffering from addiction.
Thank you. And how have your services shifted now with the pandemic being in place?
We are virtual. So most of our case managements are conducted over the phone. We use telehealth for our peer support, so that other family members are allowed to engage. Uh, we are currently going into the office 10% of our working time, so between 1 to 2 days a week, we go into the office. Um, but the capacity in our office is, very little. But CarePlus as a whole continues to take certain people in the office for medication and, prescription and intakes.
Thank you for that detailed response. What from working with the craft model, what do you see as the most benefit? I know you gave us some great details and context, but what do you see as the most beneficial part of using that evidence-based tool that you're using?
So craft is a menu-based program. First of all, it's not like 1, 2, 3, 4. Okay, so if the family says to us, "Oh, I want to work on my communication," but one of the most that's been going on during COVID has been positive communication. Um, I, you know, the problem is not really a problem, but there's such a stigma in areas of addiction that all the individual who's suffering from addiction has heard is you're bad, you're useless, you're this, you're that. And statistics have always said that if you continue to say those things to someone, they're gonna feel that. So when someone is positive towards them, they don't know how to handle it. But if you say consistently in a constant, transparent, positive communication mode, you're going to see that the individual who's suffering from addiction is going to want to engage. So transparency and positive communication together becomes a vital source, especially during COVID.
Thank you. I think that's one of the challenges that we've been dealing for so long now is that individuals who are dealing with a substance use disorder or are stigmatized and they feel that way, and sometimes their families are. So it's good to hear that the work that you're doing to break through that stigma to make sure people are getting the support that they need and that families are getting the support that they need. Uh, what are some positives that you've heard from families as it pertains to the support that you've been giving them, especially during this pandemic?
Well, one of the things is that because we have an ongoing tool of not only talking to our clients twice a week, but also peer support, I have two different aspects. I have a lot of people who enjoy peer support because it gives them a chance to see other people because they're sitting in isolation. Yeah, everybody's zoomed out. Okay, I call it a zoom up party. But trust me when I tell you that these families crave to be around people who share a similar journey, who can open up themselves with all their hearts and say, I'm hurting too. Um, you know, I've had so many people love the peer support. We laugh, we joke, we talk about education. And then, it's just, it becomes not just a peer support group. They build bonds with each other. They get each other's phone numbers and they create their own little tiny peer support group. So they call each other, oh, this is what happened. So then you have me who calls them, and just to reach out and say, I'm here for you. Some of these families is all that they need. I'm here for you. The word, I had one of my clients say to me, when I say to them, how can I help? She hasn't heard that in quite some time because she doesn't know. She says, I cannot understand how this service can be free. I'm still waiting for you to ask me for my insurance information, And I said, there is no insurance information, this is free. Um, so they're thankful to get the support. They're thankful to let somebody know they're okay. Everything is going to be okay. They just need their hands held for a little while, but that doesn't mean that we hold them all the time, because our hours are from 9 to 8, Monday through Friday. We can't hold them on the weekends. So one of the things is just to let them know you're there for them. They need that.
Very true. Very true. Thank you for sharing. Much appreciated. Is there anything else that you'd like to promote or mention
Well, one
to
of
our
the
audience?
yes, so we are taking clients at this time. There is no age restrictions. There is no relationship restrictions. It can be a mother, a father, or a friend or a neighbor. All they need is someone that's suffering from substance abuse. We are not opioid oriented per se. We do, we at this time we are accepting all clients that have a substance abuse issue, um, as a substance issue, as far as the person that they love. Um, Family members are a very important part, so they are the ones who are going to receive this our services. We also have several teams that are also grant funded, like our STARS teams works with individually with the person who's suffering from addiction. We have our RISE team that also, basically focus on the individual who's suffering from addiction. So we work as a team, as a family unit, as I call it, because we have the family, they have the individual. So we have one goal in mind, and our goal is to get people who are suffering from addiction into treatment and making them whole again.
Awesome. Thank you so much for sharing. Truly appreciate it. Ratna would truly appreciate your partnership and support here with Adapt, and the amazing work that we've been able to do together for families
Yes.
here in Essex County. And
And again, my phone number and information will be put on chat by Joel, or Joel will make sure that he gets it out to everyone. But we can be found on Facebook under CarePlus and J, and our and you can find us on the web at careplusnj.org, and look under family, and you'll see the family support information.
thank you so much. If
Thank
you
you.
if you do have any questions, of course, you can put them in the chat box, the live chat box right now. And if we do not have the answer for you today, we'll definitely touch base with Ratna, with Vanessa, and we'll get you the reply as soon as possible. But thank you so
Thank,
much for being here with us today.
thank you, Mr. Joel, and I appreciate you having us.
And as
Joel.
always,
L.
yes. And as always, if you want to stay connected with Adapt, you can always touch base with us. We are on social media on Facebook, Twitter, and Instagram, along with here on YouTube where you're watching this watch party right now. So with that, we'd say thank you very much. We truly appreciate it. And y'all have a good evening.